look ahead to Race for the Cure continues, not just with the event, but awareness. This morning, the importance of annual mammograms for women, specifically women over the age of 40. We're pleased to welcome surgical oncologist Dr. James Reilly and Kathryn Simone as a program manager, both from Methodist Estabrook Cancer Center. Good morning.
Good morning. Good morning.
Let's start before we get to women over 40. Women in their 20s, what can they be doing, or should they be doing now?
Well, they should be seeing their doctor for an annual physical exam, which should include a breast exam, and also periodically doing a self-breast examination.
The yearly mammograms, let's get to those. When do those begin?
Well, routine at age 40, and they'd be yearly mammograms, and in selected cases, if there's a close relative that's had breast cancer at a young age, it would start 10 years prior to the diagnosis of their relative with breast cancer.
What is the goal of an annual mammogram in general?
Well, we want to detect breast cancer before it's evident, before it's something they can feel, and the earlier the diagnosis, the higher the cure rate.
As a program manager, what do you do and how do you help guide patients through this process?
Mainly communication and education and the importance, and even getting out there in the public. But, you know, on the computer and on the telephone, and seeing patients on my own as well.
Do you find this awareness component that a lot of women just don't understand why an annual mammogram is so key?
Absolutely. Every day I guess I'm a little bit surprised by a patient or, a question. So I just need to keep doing what we're all doing. We have a great team and everybody's got the same goal, and we're working hard to get that information out there.
Well, we have a list of things that women should know as they are going in for a mammogram. Some of these key components of what to expect. Could you walk us through this?
There'll be a technologist in the room with them. It takes 20 minutes long, not 20 minutes in the exam itself, but 20 minutes. About 10% of people will be called back to have other tests, an additional mammogram or an ultrasound.
So don't be alarmed.
Don't be alarmed.
If you're one of those, yeah. What do patients need to bring with them? Let's say they are new to you. They've had mammograms in the past. They don't just show up and that's it. They can do a lot to help you out.
Well, ideally, if they've had mammograms other places, when they schedule, they should tell the people that register them where their mammogram was, because the radiologist interpreting the mammogram will need to compare this year's studies with previous year's studies.
Yeah, why don't women get them? What's the story here?
Well, there's fear. There are some people who fear that the mammogram will increase the risk for cancer. It does require radiation, but it's an extremely low dose of radiation. And I think there's scary stories about it being uncomfortable. And the compression with the mammogram is brief, but it is uncomfortable. As
you're working with these patients and explaining to them the importance of all of this, do you find that that's a conversation you're having to have regularly, that it's worth any sort of discomfort or risk?
Absolutely. You're just trying to get the ladies in and get the correct information. You're hoping that they then will pass the correct information along to get everybody, cost, like Dr. Reilly said, uncomfortable, all those types of things. But we have many support people that can, help out and give information. There's alternatives and to get the ladies in.
Well, we're looking forward to October, Race for the Cure, part of that. Are you starting to notice that this conversation is elevating as everyone prepares for race itself?
This time of year, it's frequent discussion about mammograms. It gets people thinking about it.
Yeah, and for you as well?
Oh, absolutely, and staff, and actually, a little bit exciting, because it really does. It puts the focus on us. We're all in this together. We're trying to get the information out there, so we like this time, too.
Well, hey, the technology exists, and we've just got to take advantage of it. But at Methodist, you can. And I love these commercials. Your staff looks so sweet, and they're pink, all lined up and ready to go. Are you participating in Race? May I ask this question?
I usually participate every year, and Kathryn does too.
Yes, I walk. Not maybe a runner, and then we'll hopefully have a booth and be able to pass out up-to-date, accurate information as well.
You know what? I rock. That's my term that I use. I run to start, and then I walk until I see someone I know and I want to pass them, and then I run again. So it's kind of this back and forth run and walk. We'd love to pass along some information for you. You can always log on to bestcare.org. Of course, the site open 24 hours a day. If it's one of those sleepless nights where you would like to learn more, you want to learn more about about mammograms, what they can do for you at Methodist Health System. The website's great. But they also have a number of area locations both throughout Omaha and Ada Council Bluffs. You see the phone number there with an extension there as well. So the three of us are going to be outside the former Quest Center, now the CenturyLink Center, on October 2nd. We would love for you to join us then as well, and you can register online for that now. I just did mine this week. It's ComanNebraska.org. October 2nd, circled on our calendars here at the Morning Blend. We hope it is on yours as well. And the number to access Komen, Nebraska is 502-2979. Thank you both for being here.
Oh,
An
thank you.
important topic, and we look forward to continuing this up until October 2nd.
Great. Thank you.
Thank you.
All right, sit tight.